If you have a tooth missing and you're contemplating what is the best option for you to replace that tooth, before implants, people had two options. They had dentures, which are removable and rather uncomfortable. They move, you've got to take them out, put them in, wash them. Bridges are quite comfortable. They are fixed to your teeth. The only disadvantage of bridges is that to be able to make a bridge, we literally have to shave adjacent teeth. And if adjacent teeth are already fragile and compromised, and they would benefit from some sort of reinforcement, then bridge may not be such a bad idea for you. However, to damage brand new healthy teeth is not something that I like to recommend to my patients. And that's where implants come into play, and that's where they are so fantastic and nothing like what we've had in the past. What implants do is that they replace your natural tooth with something that is very similar to your own natural tooth, and we don't need to involve any other teeth in the equation. A tooth is replaced with a tooth, and we don't need to shave or injure adjacent teeth, and that's one of the biggest advantages of implants.